Hey everyone, and welcome back to the Deep Dive. Today we're going to be talking about something that is super important for your nursing career. Rest and sleep.
Yeah, it may not be the most exciting topic,
I know, right?
but it's something that everyone needs to know about,
Good for you.
especially if you're going into nursing.
It's one of those essential things.
You're going to be dealing with patients who have a lot of different sleep issues.
Right, and we have to know how to help them. Plus, if we don't get enough sleep ourselves,
Absolutely.
it's going to impact our ability to give good care. To kind of illustrate the importance of sleep, we've got two cases to think about during this deep dive.
Okay.
First up, we have Jeanette and her 15-year-old daughter, Abby.
Okay.
Abby is constantly tired, and Jeanette's like, what's going on?
Yeah, teenagers,
Why is she sleeping all the time?
they need a lot of sleep.
And then there's Charlie,
Yeah.
an 86-year-old gentleman in a long-term care facility
Okay.
who's also having trouble sleeping.
Right. Sleep disturbances are very common in older adults.
We're going to revisit their cases throughout our deep dive today, and by the end, you'll be able to apply your newfound sleep knowledge to help patients just like them.
That's the goal.
Let's start with the basics.
Okay.
What exactly is sleep?
Right.
It seems pretty simple,
Right.
but it's actually a lot more complex than we think, isn't it?
Yeah, it is. It's more than just,
Right.
closing your eyes and resting. Sleep is actually an altered state of consciousness where your body and your mind can really restore themselves. It's essential for pretty much every system in the body.
Wow.
Tissue repair,
Yeah.
hormone regulation, memory consolidation, even emotional processing.
So it's not just about,
Right.
feeling rested. It's really crucial for both our physical and mental health.
Yes, absolutely.
Okay, so our bodies are kind of designed to operate on a rhythm,
Yes.
right? We've got this sleep-wake cycle
Right.
that's regulated by our internal clock.
Our internal clocks.
What's it called?
Yeah, our circadian rhythms.
Circadian rhythms.
Yes.
I feel like I've heard that those are influenced by light and darkness.
Yes, light and darkness are the main cues, but there are other things too.
Oh, really?
Yeah, it's really our body's master timekeeper,
Okay.
influencing everything from
Very good.
hormone secretion to even body temperature.
Really? So that's why when we get sick sometimes,
Yeah.
the temperature goes up and down.
Exactly.
Yeah.
And those fluctuations throughout the day are all part of our circadian rhythm.
So our bodies are really complicated.
I are.
I'm starting to realize.
Yes,
That's why a regular sleep schedule is so important.
absolutely.
It helps keep our circadian rhythm in sync.
Yes. It's like setting your watch to the right time.
Okay, so here's where I think things get even more interesting.
Okay.
Sleep isn't just one long block of time.
No, it's not.
We actually cycle through different stages throughout the night.
Yes.
I vaguely remember learning about NREM and REM sleep
Right.
from like
Those are the two main categories of sleep.
AMP. Yeah.
Non-rapid eye movement sleep, which is NREM,
Yes.
and then REM sleep, which stands for rapid eye movement sleep.
Okay, so NREM.
Yeah.
Is that when we're like really resting and repairing?
That's when your body's really doing most of its repair work.
Okay.
Your muscles are relaxing,
Yeah.
your breathing slows down, your heart rate slows down.
And then REM sleep is when we have those crazy dreams.
Yes. That's when the brain is very active.
Okay, so you said NREM is divided into stages, right?
Yeah. So NREM actually has 4 stages.
Oh, wow.
Stage 1 is like that light sleep, and
Correct.
you're just drifting on
Like that drowsy phase?
Exactly, yeah. Stage 2 is a little bit deeper.
Okay.
Your brain waves start to slow down.
Okay.
And then stages 3 and 4, those are like the deepest, most restorative sleep.
Okay.
Sometimes it's called slow wave sleep or delta sleep.
Okay, so deep sleep is really important.
It is. It's crucial for physical recovery, growth, and even memory consolidation.
So during those deep stages of NREM sleep,
Right.
our parasympathetic nervous system takes over.
Yes.
It's like our body's rest and digest mode.
Right. Exactly. It slows our heart rate,
Yeah.
lowers our blood pressure, really gives the body a chance to repair and recharge.
So then we shift into REM sleep.
Right. After going through those 4 stages of NREM sleep, usually about 90 minutes or so, you transition into REM sleep.
Okay, and this is where things get a little more active.
Yes, it's almost like a paradox because your brain activity increases.
Right.
Your eyes dart around.
So our eyes are moving rapidly. That's where the name comes from.
Exactly. And we tend to have those vivid, crazy dreams during this stage,
Right.
but your muscles are essentially paralyzed.
Oh, wow. So we're not acting out our dreams.
No. Thankfully, not usually.
Okay. So it's like a typical night of sleep is like going down a ladder
You got it.
through NREM,
Through the stages.
hitting that REM sleep, then climbing back up and then repeating the cycle again.
Exactly. And we go through this cycle multiple times throughout the night.
And then every time we wake up,
Yeah.
even if it's just briefly,
Even briefly.
the cycle starts over.
Yes.
That's fascinating.
It is.
So that explains why maybe Charlie,
Right.
our 86-year-old gentleman, might be feeling so tired. He's waking up frequently throughout the night, which means he's not getting enough of that deep sleep.
Exactly. Those frequent awakenings really disrupt that sleep cycle.
And can lead to lighter sleep.
Exactly.
This is why we always talk about getting enough sleep.
Yeah.
But it's also important to understand that sleep needs are different for everyone, and they change as we age.
Absolutely. Everyone's sleep patterns are unique.
Tell me more about these developmental sleep patterns.
Yeah.
I know, like, babies sleep a ton.
Yes.
But what about teenagers like Abby? Why are they always so sleepy?
Well, newborns definitely sleep the most. They can sleep up to 16 hours a day.
16 hours.
Yeah, but they spend more time in REM sleep than adults do. As we grow, the total sleep time decreases. But that deep sleep is still super important for growth and development,
Okay.
especially for teenagers like Abby. Teenagers actually need quite a bit of sleep.
So they're not just being lazy.
No, they're not.
They really do need those extra hours.
They need about 8 to 10 hours of sleep per night.
Wow, that's a lot.
Yeah,
Okay.
it is to support their rapid physical and cognitive development.
And what about older adults like Charlie?
As we get older, sleep patterns shift again.
Hmm.
Older adults, like Charlie, often experience lighter sleep, more frequent awakenings,
Mm-hmm.
and a decrease in slow wave sleep.
Okay, so it's not their fault that they're not sleeping as well.
It's not, no.
It's just a natural part of aging.
It is a natural part of aging.
But it is something that we need to be mindful of as nurses.
We do. We need to understand those changes and how they can impact our patients' health and well-being.
Okay, so we've talked about, like, those basic sleep cycles and how they change throughout life.
Yeah.
But I'm curious about, like, all the things that can mess with our sleep.
Oh, yeah.
Like stress or drinking coffee late at night.
Yeah, there are so many things that can affect sleep, both positive and negative.
Really? Like, give me some examples.
Well, exercise, for example. Remember Jeanette's daughter, Abby?
Yeah.
Turns out adolescence isn't just a time of rapid growth. It's also a time of increased physical activity. So all that energy she's expending could definitely be playing a role in her sleep patterns.
Okay, that makes sense.
Exercise is generally great for sleep,
Yeah.
but doing it too close to bedtime can make it harder to wind down
Right, yeah.
and fall asleep. But what we eat and drink can also have a big impact.
Oh, yeah. Tell me about that.
Well, there's this amino acid called L-tryptophan
Yep.
that's found in protein-rich foods.
Okay.
And it's been linked to sleep regulation.
Isn't that the thing in turkey that makes you sleepy after Thanksgiving dinner?
That's the one.
Oh, okay.
But it turns out that pairing tryptophan-rich foods with healthy carbohydrates might actually be more effective in promoting sleep.
Interesting.
It's all about finding that right balance.
So a little peanut butter on toast before bed could be helpful.
It might be. Definitely worth a try for some people.
Okay.
On the other hand, we all know about the sleep-disrupting effects of caffeine and alcohol, and nicotine, too, can act as a stimulant and interfere with sleep quality.
So we've got exercise,
Right.
diet, avoiding those stimulants. What about when someone's sick? How does that impact sleep?
Oh, illness can really mess with sleep in so many ways. Think about it.
Yeah.
Discomfort, pain, anxiety,
Medication.
medications, yeah. All of those can make it hard to rest.
Right.
For example, people with GER,
GERD.
gastroesophageal reflux disease.
Okay.
They often wake up at night with heartburn
Really? Why is that?
because those gastric secretions actually increase during REM sleep.
Oh, wow.
Even certain types of epilepsy are associated with specific sleep stages. It really highlights how interconnected sleep is with our overall health.
It's like a domino effect.
It is.
Illness disrupts sleep, and then poor sleep makes it harder for the body to heal and fight off the illness.
Exactly. And it's not just acute illnesses. Chronic conditions like liver failure, thyroid disease, even kidney disease can all lead to significant sleep disturbances.
Wow, so sleep is really important.
It's a vital sign.
And sleep disorders are more common than we realize.
They are.
So let's dive into some of those common sleep disorders, starting with insomnia.
Okay, yeah.
What exactly is insomnia and what causes it?
Well, insomnia is basically trouble falling asleep,
Okay.
staying asleep, or both. You might lie in bed for ages before you finally drift off.
Tossing and turning?
Tossing and turning, yeah.
Yeah.
Wake up multiple times throughout the night, or wake up way too early and can't get back to sleep.
And it's not just about, like, feeling tired the next day.
Right. It can affect so many things.
Yeah.
Your mood.
Yeah.
Your concentration.
Work performance.
Work performance, absolutely.
Right.
Even your relationships.
Right. And chronic insomnia has been linked to some pretty serious problems.
Yeah.
Like depression,
Anxiety,
anxiety, even heart disease.
not something to take lightly.
So what causes insomnia? Is it always just stress?
Stress is a big one,
Okay.
but there are a lot of other things that can contribute too.
Like what?
Poor sleep habits,
Okay.
medical conditions,
Mm.
certain medications,
Right.
psychological factors like anxiety and depression. It can
Okay.
be really complex.
So we really need to figure out the root cause
Yes,
to help someone with insomnia.
absolutely. It's not just about giving them a sleeping pill.
Right.
We have to address the underlying issue.
Okay, what about obstructive sleep apnea? I feel like I hear that one a lot.
Yeah, that's another really common one.
What exactly is going on in the body when someone has obstructive sleep apnea?
Well, OSA stands for obstructive sleep apnea.
Right.
And basically what happens is the upper airway
Okay.
collapses repeatedly during sleep.
Collapses.
Yeah, it blocks airflow.
Oh, wow.
So the person might actually stop breathing for several seconds.
Oh, that sounds scary.
It can be, sometimes even up to a minute,
Wow.
before their brain realizes something's wrong and jolts them awake.
So they're basically gasping for air multiple times throughout the night.
Yes, essentially.
No wonder people with sleep apnea are so tired.
They are exhausted.
And it's not just about being tired, right?
Right.
There are more serious consequences.
It's associated with a higher risk of high blood pressure, heart problems, stroke, even accidents due to excessive daytime sleepiness.
So it's really important to catch it early.
Absolutely, yes.
What are some signs of sleep apnea? I'm guessing, like snoring.
Snoring can be a big one,
Okay.
especially if it's loud and irregular.
And it's punctuated by these periods of silence followed by like a gasping or snorting sound.
Okay, that's good to know.
Other signs to look out for are morning headaches, waking up with a dry mouth,
Okay.
and just excessive daytime sleepiness.
Okay, so we've talked about insomnia, which
Right.
is where people have trouble sleeping, and sleep apnea, where breathing is disrupted during sleep.
Right.
What about hypersomnia? How is that different?
Hypersomnia is essentially excessive sleepiness,
Okay.
even after getting what seems like enough sleep. People with hypersomnia might sleep for long stretches at night,
Okay.
but they still feel tired during the day.
Oh, that sounds awful.
It can be very debilitating. They might have difficulty waking up in the morning or even unintentionally fall asleep during the day.
So unlike insomnia, where there's difficulty falling or staying asleep,
Right.
hypersomnia is more about that overwhelming feeling of sleepiness.
Yes, exactly.
Mm-hmm.
And the causes are varied, just like with insomnia.
It could be an underlying medical condition, certain medications, or even psychological factors.
So again, figuring out the root cause is key.
Absolutely.
Now, for a sleep disorder that I've always found kind of fascinating,
Oh, yeah.
narcolepsy, I've heard it described as sleep attacks, but what's really going on?
Well, narcolepsy is a neurological disorder
Okay.
that causes these sudden, uncontrollable urges to sleep.
But so their brain is just like, nope, time to sleep.
Basically, it's like the brain's sleep-wake switch malfunctions. People with narcolepsy can literally fall asleep at any moment,
Oh, wow.
even during activities like talking, eating, or driving.
That sounds so dangerous.
It can be incredibly disruptive and dangerous.
So besides these, like, sleep attacks, are there any other symptoms of narcolepsy?
Yeah, there are some other really unique symptoms that can occur with narcolepsy. One is called cataplexy.
Cataplexy?
Yeah, it's a sudden loss of muscle control, triggered by strong emotions.
So, like, you could be laughing and just suddenly collapse.
Exactly. It's like your muscles momentarily give out.
Oh, wow.
There can also be hallucinations and sleep paralysis, which is a temporary inability to move or speak while falling asleep or waking up.
That sounds terrifying.
It can be very frightening.
Okay, so narcolepsy definitely sounds like a challenge to manage.
It can be. But thankfully, there are treatments, including medications and behavioral therapies, that can help people with narcolepsy live full and active lives.
That's good to know.
Yeah.
Okay, now let's talk about parasomnias.
Okay, yeah.
What exactly falls under that umbrella term?
Parasomnias are those unusual behaviors or experiences that occur during sleep or during those transitions between sleep stages.
So like sleepwalking.
Sleepwalking, yeah. Or somnambulism, that's the clinical term.
Yeah.
Sleep terrors, nightmares, even bedwetting.
So these aren't your typical trouble falling asleep kind of problems.
Right, exactly.
These are more about actions or events that happen during sleep.
Precisely.
Yeah.
And while we often associate them with children, they can happen in adults too.
Interesting. Okay, let's break down a few that seem particularly relevant to nursing.
Okay.
Starting with sleepwalking or somnambulism. What exactly is going on there?
Sleepwalking usually occurs during deep NREM sleep. The person might get up and wander around, even perform complex actions,
Oh, wow.
all while being completely unaware of their surroundings.
Okay, that sounds a little creepy. What about REM sleep behavior disorder? How is that different from sleepwalking?
REM sleep behavior disorder, or RBD, is interesting because the muscle paralysis that normally happens during REM sleep is absent.
So they're not paralyzed?
They're not.
Oh, wow.
Which means they can physically act out their dreams.
Oh, no.
Yeah, talking, yelling, punching, kicking.
So they could actually hurt themselves or someone else?
Yeah, it can be pretty dangerous. Definitely something we need to be aware of as nurses.
Okay, what about sleep terrors? I've heard those are pretty scary to witness.
Sleep terrors are sudden episodes of intense fear and screaming.
Oh, wow.
They usually happen during deep NREM sleep.
Okay.
And unlike nightmares, which happen during REM sleep, people usually don't remember sleep terrors.
So they wake up screaming, but they don't know why.
Exactly.
That's wild.
They might seem awake and terrified,
Okay.
but they're usually unresponsive to comfort.
Oh, wait.
And then they have no memory of the episode in the morning.
Okay, so what's the difference between a sleep terror and a nightmare?
Well, nightmares are more like vivid, disturbing dreams that can wake someone up feeling scared or anxious.
Okay, so those happen during REM sleep.
Right, and they're often remembered, unlike sleep terrors.
Okay, that makes sense.
Yeah.
And lastly, we have sleep enuresis.
Yes, bedwetting.
Bedwetting, okay.
Right.
So how is that considered a parasomnia?
Well, bedwetting involves involuntary urination during sleep.
Right.
It's at most common in children, but it can happen in adults too.
Okay, interesting. So we've covered a lot of different sleep disorders, but what happens when we simply don't get enough sleep?
Yeah, that's sleep deprivation.
Sleep deprivation, right.
Yeah.
This seems like a really big issue, not just for patients, but also for healthcare workers like us.
It's huge. It's a pervasive problem in our society, and it impacts both physical and mental health.
So let's define it. What do we mean by sleep deprivation?
It's basically a state of inadequate sleep.
Go.
Whether it's because you're not getting enough hours of sleep, you have difficulty falling or staying asleep,
Yeah.
or you have a medical condition that disrupts your sleep.
Yeah.
And it can show up in different ways, too.
Right.
Like, some people experience partial sleep deprivation, meaning they consistently get less sleep than they need.
Okay, so not enough hours.
Right. Others experience excessive daytime sleepiness, which is that overwhelming feeling of fatigue and drowsiness during the day.
Right, like you could fall asleep at any moment.
Yeah, exactly.
And the consequences of sleep deprivation go way beyond just feeling tired.
Oh, absolutely.
Like what happens when we're sleep deprived?
Well, it affects our cognitive function, making it harder to concentrate, to learn, and to make decisions. It also impacts our mood, making us more irritable, anxious, and even prone to depression.
Right.
And there's a link between sleep deprivation and some serious health problems.
Oh, yeah.
Like obesity,
Yeah.
heart disease,
Okay.
even a weakened immune system.
Wow. So it's really important to get enough sleep.
It is crucial for our health and well-being.
So how does sleep deprivation actually impact our health? Like what's going on in the body?
Well, when we're sleep deprived, our bodies release more of the stress hormone, cortisol.
Cortisol.
Yeah. And that can contribute to weight gain and increase the risk of cardiovascular problems.
Okay.
Sleep deprivation also weakens our immune systems,
Right.
making us more susceptible to infections. And perhaps most alarmingly, it increases the risk of accidents and injuries.
Especially in professions where alertness is critical.
Absolutely, yeah.
You know, healthcare workers, pilots, truck drivers, even a small amount of sleep deprivation can have devastating consequences.
Exactly.
So as nurses, we need to be really vigilant about both our own sleep health and that of our patients.
We do. It's a shared responsibility.
Okay, so let's shift gears a little bit and talk about the role of nurses in promoting rest and sleep.
Yeah.
We're not just administering medications.
No.
We're also advocates for healthy sleep habits.
Absolutely. Nurses are in a unique position to assess, educate, and implement interventions that can really make a difference in people's sleep quality.
So how do we do that?
Well, the first step is assessment.
Okay.
We need to gather all the necessary information about our patients' sleep habits and any potential problems.
So, like, we ask them about their usual bedtime,
Yes.
their wake-up time,
Uh-huh.
how easily they fall asleep,
Exactly.
whether they wake up during the night,
Yeah.
how rested they feel in the morning.
All of those things. And we also want to ask about their lifestyle, their diet, their exercise habits, any medications they're taking, and any medical or psychological conditions that could be affecting their sleep.
So it's like a really comprehensive assessment.
It should be, yes.
Okay. And do we just rely on, like, the patient's self-report?
Well, self-report is important, but we also have some tools we can use to gather more objective data.
Like what?
Sleep diaries can be really helpful.
Sleep diaries?
Yeah.
Okay, explain that.
Basically, it's a way for patients to track their sleep patterns over a period of time. They note down things like when they went to bed, how long it took them to fall asleep, any awakenings during the night, and how they felt when they woke up.
So it's like a food journal, but for sleep.
Exactly. It helps you see patterns and identify potential triggers.
Okay, that's cool. Anything else?
We also have some standardized questionnaires, like the Epworth Sleepiness Scale. That can help us screen for excessive daytime sleepiness,
Okay.
which is a hallmark of a lot of sleep disorders.
Okay, and what about the physical assessment?
Oh, yeah, we can't forget about that.
Right.
There are definitely some clues we might pick up on during a physical exam that could indicate a sleep problem.
Okay, so what are we looking for?
Things like dark circles under the eyes, puffy eyelids, yawning or rubbing their eyes a lot, slumped posture, slowed speech.
So those could all be signs of fatigue.
Exactly. And if we observe the patient while they're sleeping, we might notice restlessness, snoring, or even unusual movements, like leg jerking.
Leg jerking?
Yeah, that could be a sign of restless leg syndrome.
Oh, okay.
All of these observations, along with the patient's history and any sleep study results, help us form a nursing diagnosis and develop a targeted plan of care.
So what are some common nursing diagnoses related to rest and sleep?
Well, we might see things like insomnia, sleep deprivation, disturbed sleep pattern, or even risk for injury related to excessive sleepiness.
Right, yeah.
The specific diagnosis really depends on each individual patient's situation.
Okay, so we've assessed, we've diagnosed, now it's time for action.
Yes.
What are some interventions that nurses can use to help patients get better rest and sleep?
This is where nursing really shines. We have so many tools, both pharmacological and non-pharmacological, that can make a real difference.
Let's start with the non-drug approaches.
Okay, yeah.
I'm guessing a quiet, comfortable sleep environment is key.
Absolutely. We need to think about what helps us sleep best.
Right.
A dark, quiet room, a comfortable temperature.
The right amount of blankets.
Exactly. We can help our patients optimize their sleep environment by controlling the noise and light levels, making sure they have comfy bedding, and adjusting the room temperature to their liking.
And I'm sure establishing a regular sleep-wake routine is super important, too.
It is. Just like children thrive on predictable routines, our body's internal clocks work best with a regular sleep schedule.
Right, so going to bed and waking up around the same time each day, even on weekends, can help.
It can, yeah. It helps reinforce that natural sleep-wake cycle.
But that's going to be tough for shift workers.
It is challenging, but there are things we can do.
Managing light exposure can be really helpful.
Right. Bright light in the morning helps reset that internal clock. And for those working the night shift, wearing dark sunglasses on the commute home can actually help too.
Wow. It's like we can actually manipulate our biology with light.
We can to a certain extent, yeah.
What about food?
Oh, yeah.
I remember reading somewhere that, like, having a small bedtime snack with protein and carbs can be helpful.
It can be for some people, but it really depends on the individual.
Okay, so not for everyone.
Right. Like if a patient has GERD, for instance, a big meal before bed is a bad idea.
Right. Yeah, makes sense.
That's why those detailed sleep assessments we talked about are so valuable.
Right. Yeah. Getting all that information, asking all the questions, and having them use that sleep diary can really help us tailor our interventions.
Exactly. It's not a one-size-fits-all approach.
Okay, so speaking of interventions, let's kind of shift gears a little bit and talk about what we can do as nurses to actually help our patients sleep better.
Yeah.
Especially in, like, a hospital setting.
Right.
Which isn't really known for being peaceful and quiet.
No, not at all.
So how do we promote rest and sleep when there's so much going on?
That's a great question. And you're right. Hospitals can be very challenging environments for sleep.
Yeah.
But there's still a lot we can do to help our patients get the rest they need.
Okay. I'm all ears.
Well, the first step is awareness.
Okay.
We need to be mindful of all the factors that can disrupt sleep in a hospital setting.
Things like those noisy alarms and bright lights.
Yes, exactly.
Frequent vital sign checks.
Mhm.
And just the general hustle and bustle of a 247 environment.
It's a very busy place.
Yeah.
But we need to find ways to minimize those disruptions whenever possible and create a more sleep-conducive environment for our patients.
So, what are some practical things we can do?
Well, we can try to cluster care activities
Oh.
whenever possible, so we're not waking patients up multiple times throughout the night for different things.
So instead of checking vital signs every 4 hours,
Right.
maybe we can group those checks with medication administration or other tasks.
Exactly.
Okay. Yeah. We can also be more strategic about the timing of medications.
Okay, like if a patient's always waking up in the middle of the night to use the bathroom,
Yeah,
maybe we can talk to the doctor about giving their diuretic earlier in the day.
exactly. That's a great example.
Okay, that makes sense. What about noise control?
Oh, yeah, that's a big one.
I know, I feel like hospitals are just full of beeps and buzzes and everything.
They are.
But surely there are some things we can do. There are. We can make sure alarms are set at an appropriate volume.
Okay.
Avoid unnecessary conversations in the hallways.
Right.
And just encourage staff to be mindful of their volume, especially at night.
I've seen some hospitals actually implementing quiet hours policies
Yeah, those can be very effective.
where they dim the lights and try to minimize noise and disruptions.
Exactly. It's about creating a culture of respect for sleep for both patients and D staff.
That's so important.
It is. And sometimes those simple things like
Yeah.
earplugs and eye masks can make a big difference.
Yeah, I always pack those when I travel.
They can really help block out that light and noise, make it easier to fall asleep and stay asleep.
I'm curious, is there any research on how effective those are?
Oh, yeah, definitely. There's a study that was published in a nursing journal a few years back that found that patients in a cardiac care unit
Okay.
who were given earplugs and eye masks
Okay.
reported less sleep disturbance,
Wow.
and they actually had increased sleep efficiency.
So those little things can actually make a difference.
They can. It just shows the importance of patient comfort and creating a sleep-conducive environment.
Right, and it all comes back to that patient-centered care we're always talking about.
Exactly.
Really listening to our patients, understanding their needs,
Yeah.
preferences,
Uh-huh.
and involving them in the plan of care.
Exactly. We need to ask them about their sleep preferences and create a plan that works for them.
So some patients might prefer a completely dark room, while others might need a nightlight.
Right. And some people might need white noise
Yeah.
to block out other sounds,
Okay.
while others need complete silence. It's about figuring out what works for each individual.
Right. That's why those sleep assessments are so important.
They are. The more information we have,
Yeah.
the better we can individualize our interventions.
It's like putting together a puzzle,
It is.
using all those pieces of information to really get a complete picture of the patient's sleep health.
That's a great way to think about it. And it really highlights how important it is to use our nursing judgment to create that sleep-conducive environment that supports healing and well-being.
Okay, so it's not just about the physical environment, right?
Right.
We also need to think about any psychological or emotional factors.
Absolutely. Anxiety, stress, worry, those are all huge sleep disruptors.
Right.
We have to remember our patients are often in a very vulnerable position,
Yeah.
facing health challenges that can be really stressful.
So in addition to, dimming the lights and controlling the noise,
Right.
we might also need to incorporate some relaxation techniques, guided imagery, maybe even counseling
Yeah, those can be very effective.
to help patients manage their stress and anxiety.
It's about taking that holistic approach.
Right.
Considering the whole person,
Mm.
not just their physical symptoms. And remember, it's not just about the patients, it's about us too. As nurses, we need to be mindful of our own sleep health.
That's a really good point. I feel like nurses are kind of notorious for working long hours,
We are.
odd shifts, dealing with a lot of stress.
Right.
All of that can definitely take a toll on our own sleep.
It absolutely can. And like we've discussed, sleep deprivation can lead to fatigue,
Yeah.
impaired concentration,
And increased risk of errors.
yeah, and even burnout.
It's like that saying, you can't pour from an empty cup.
Exactly.
We need to take care of ourselves in order to effectively care for others.
Absolutely.
So what are some strategies for prioritizing sleep and making it a non-negotiable part of our self-care routine?
Well, I think it starts with recognizing that sleep is just as important
No.
as eating healthy and exercising.
Right.
It's not a luxury.
It's a necessity.
It is, absolutely. We need to schedule time for sleep, just like we schedule time for everything else.
Right. So just like we encourage our patients to establish a regular sleep-wake routine, we need to do the same for ourselves.
Yes, even when we're working rotating shifts.
Right.
We can try our best to maintain some consistency. It really helps regulate those circadian rhythms.
Okay, and we need to practice what we preach.
Yes.
You know, all those sleep hygiene practices we talk to our patients about.
Right.
Avoiding caffeine and alcohol before bed. Creating a relaxing bedtime routine.
Yes.
Making sure our bedroom is dark and quiet and cool.
Those are all great tips. And don't forget about naps.
Naps.
Yeah. A well-timed short nap can do wonders for restoring alertness and reducing fatigue, especially during those long shifts.
Okay, but I feel like naps can be tricky.
They can.
If you take a nap that's too long or too close to bedtime, it can actually mess up your sleep.
Exactly. Keep those naps short, like 20 to 30 minutes max, and avoid napping too late in the day.
Okay, good advice.
Yeah.
And if you're dealing with more serious sleep problems, don't hesitate to reach out for help.
Absolutely. There are sleep specialists and therapists who can help you identify any underlying issues and develop a personalized treatment plan.
And just like we advocate for our patients, we need to advocate for ourselves too.
We do.
You know, if you're feeling chronically sleep deprived, talk to your manager.
Yes, good point.
Maybe they can make some adjustments to your schedule or workload.
Exactly. We need to create a work culture that supports healthy sleep habits for everyone.
Right. Good sleep isn't a luxury.
No, it's essential.
It's an investment in our health, our well-being, and our ability to provide safe and effective care.
I couldn't agree more.
Okay, so as we wrap up this part of our deep dive into rest and sleep, let's revisit Jeanette and her teenage daughter, Abby. Remember, Abby's always tired. And then there's Charlie, our 86-year-old gentleman, who's struggling to sleep well in the long-term care facility. What stands out to you now?
Well, what strikes me is how individual each case is.
Right.
Abby's sleep challenges are likely very different from Charlie's.
Yeah, it's not a one-size-fits-all situation.
No, it's not.
So we need to take that holistic approach to assessment and intervention.
We do.
Considering age, lifestyle, environment, medical conditions, psychological factors.
All of it, yes.
All connected.
It is, yeah. There's no one-size-fits-all solution.
So for Abby, it might be about adjusting her sleep schedule, limiting screen time before bed, finding healthy ways to manage stress.
Exactly. And for Charlie, it might involve adjusting his medications, optimizing his sleep environment, addressing any underlying anxiety or discomfort he might be experiencing.
And perhaps most importantly, it's about empowering both Abby and Charlie and all of our patients to become active participants in their sleep care.
Absolutely. We want them to feel informed and heard and supported in their journey toward better sleep.
I love that. This deep dive has been so insightful.
Sure.
I feel much more prepared to address sleep issues with my future patients.
I'm so glad to hear that. And remember, it's not just about them, it's about you too.
Right, yeah.
Nursing is a demanding profession.
It is.
And prioritizing your own sleep is crucial for your well-being and your ability to provide excellent patient care.
So to all of our future nurses out there listening, embrace the power of sleep.
It's a superpower.
It really is.
For health and well-being.
It really is amazing how something so fundamental can also be so complex.
It is, yeah. Sleep is something we all do, but there's so much going on behind the scenes. And for nurses, understanding all those complexities, it's really important. Think about it. You're going to encounter patients with all sorts of health challenges, from acute injuries to chronic illnesses. And pretty much every condition you can think of can be impacted by sleep, either positively or negatively.
So if we can help our patients get better sleep, we're not just, managing symptoms. We're really supporting their healing.
Exactly. It's foundational to their well-being.
Okay.
And that foundation starts with us as nurses, understanding the science of sleep. Recognizing those red flags, the signs and symptoms that might indicate a sleep disorder, and knowing how to put those evidence-based interventions into practice.
And we can't forget about patient education.
Oh, absolutely.
We need to empower our patients to take an active role in their sleep care.
We do.
Making those lifestyle changes, adopting those healthy sleep habits.
Right, and advocating for themselves when they're having trouble sleeping.
It's a team effort.
It is.
This has been such an insightful deep dive. I feel much more confident in my ability to address sleep issues with my future patients.
That's great to hear. And remember, it's not just about them.
Right.
It's about you, too.
Yeah.
Nursing is a demanding profession.
It is.
And you need to make sure you're getting enough rest, too.
Good sleep is important for everyone.
It is.
So, to all of our future nurses out there,
yes,
embrace the power of sleep.
Absolutely.
It truly is a superpower when it comes to health and well-being.
Sweet dreams, everyone.
And happy nursing.